Welcome, everyone. My name is Anne-Marie McMahill. I'm a research scientist and the manager for the Center for Health and Safety Culture, and I'm excited you were able to join us today to be able to share some ideas with you on reducing underage drinking with practical tools that develop social and emotional skills. So just a few housekeeping items before we begin with the content. The webinar today is being recorded. We will have it up on our website within the next few days. So if you want to watch parts of it again or share it, you're going to be able to do so. If for any reason during the webinar you lose connection with the audio, that happens, just go back and find the phone icon, click on it, and that will allow you to reconnect with the audio by having the system call you, by calling back in, or by listening over your computer. So right now we have everyone muted, so we have a better audio quality with the recording. If you have any questions, feel free to send those through the question and answer panel. I'll keep an eye on that, and I'll try to address those questions if I'm able during the presentation. If I can't get to them, I'll do my best to address it at the end. So I have a handout if you'd like it for the presentation. Some of you got it in the invitation to this webinar. Our website, chscculture.org, you can access it from the homepage right here on the bottom. Or if you don't want to download it now, you might want to have a piece of paper or something to write with at a hand. I'll be asking you to jot down a few notes at the beginning of the presentation. Okay? So a bit of background about the center. We are an interdisciplinary center at Montana State University. We conduct research to explore how culture impacts health and safety. And we know that culture, the word culture is a very big word, and it's a very complex topic. We look at culture through a lens of shared values, attitudes, beliefs, and how those influence a wide array of behaviors engaged in by a wide array of stakeholders in terms of influencing health and safety. We think it's extremely important to bring what we've learned out to the field. A lot of our work is also focused on training, sharing ideas like this webinar, and by doing guidance with communities. So all of our research is sponsored by agencies wanting to move the needle on real issues. Oops. So our work covers a lot of issues, but predominantly these four. So together, these have a profound impact on health and safety, and they are really the leading causes of years of potential life lost, and they also overlap. We know that the misuse of substances has profound impact on traffic safety, and likewise, violence and child maltreatment are impacted by substances. All of these are interconnected. At the federal, state, and community level, these issues are addressed in different ways, and it's interesting to see how departments of transportation approach behavior change and health and safety and compare that to efforts to reduce underage drinking or domestic violence. So working in these domains is very insightful for us, and our big picture is to step back and look at an overall approach that transcends any given issue. So what I'd like to do today is to begin with a brief exercise. I want you to think for a few moments about someone that you would identify as successful, and just think about them as clearly as you can for 5 seconds. And then I'd like you to think of someone that you would identify as not successful, and think about that person as clearly as you can for about 5 seconds. And then take a moment, if you could, and just write down in as many ways, like words or short phrases, about why you can think of to why those two people are different. So in past presentations, I've asked these same two questions, and I've often heard things like, They're different because, one person is confident, or they have a work ethic, or they're empathetic, they're good communicators, they take time to reflect, they're resilient, and maybe some of those thoughts are similar to what you have just jotted down on your paper. But often what I hear is many of the things that people identify are social and emotional skills. And social and emotional skills are one of the things that allow people to be successful. So social and emotional skills can be grouped to create 5 components or 5 competencies, which I'll show in this pie chart. This diagram is also found in the handouts that's on our website. 2 of the components, the ones that are in the red, focus on self, like within myself. 2 of the components focus on others, like your awareness of others. And 1 on the choices we make about our personal and social behavior. So I'm going to take a minute and just dig into these a little bit more. So self-awareness is the first one. It's all about knowing your emotions, your personal and weaknesses, and having a strong sense of your own worth. It helps us understand who we are and why we do the things we do. So self-awareness is the ability to accurately recognize your emotions, your thoughts and values, to be able to accurately assess your strengths and limitations. It's what gives you a well-grounded sense of confidence, optimism, and what people call a growth mindset. So individual skills include identifying emotions, accurate self-perception, recognizing strengths, and self-efficacy, believing in yourself. The second one that focuses on self is self-management. So it's how you control and manage yourself and your emotions, your thoughts and your behaviors in different situations. It's how you effectively manage stress, control your impulses, and motivate yourself by setting and working toward personal and academic goals. So specific skills include impulse control, stress management, self-discipline, self-motivation, goal setting, and organizational skills. So now we start looking at those that focus on others. So social awareness are skills to handle other people's emotions effectively. Social awareness is the ability to take the perspective of and empathize with others, to understand social and ethical norms for behavior, to recognize family, school, and community resources and supports, and to pick up on emotional cues, often from body language, someone's tone of voice, or other nonverbal elements of communication. So skills for this include perspective taking, empathy, appreciating diversity, and respect for others. Relationship skills are the next, and they are the ability to establish and maintain healthy and rewarding relationships with diverse individuals and groups, to communicate clearly, listen well, and cooperate with others. Relationship skills help you resist inappropriate social pressure or negotiate conflict constructively and seek and offer help when needed. Individual skills might look like communication, social engagement, relationship building, and teamwork. And the last of these competencies is responsible decision making. So responsible decision making is all about the choices we make about our personal and social behavior. Responsible decision-making is the ability to make constructive choices about our personal behavior and social interactions based on ethical standards, safety concerns, and social norms. It's the ability to realistically evaluate consequences of various actions and the consideration of the well-being of others and oneself. So individual skills would include analyzing problems, identifying problems, solving problems, evaluating, reflecting, ethical responsibility, and it all looks at the choices that we make about our personal and social behavior. So this is all of them together. So if you were looking at those, so these are our social and emotional competencies. So in some context or another, I'm sure that you were familiar with these. These were some of the skills that I mentioned below each of the competencies. So as I was defining those, I'm sure that you could hear that this isn't necessarily something new. You've heard aspects of this before. And if we sort of look back on where we started talking about social and emotional skills and competencies, we know that Harvard education professor, Dr. Gardner, published a theory in 1983 about multiple intelligences humans possess, specifically inter- and intrapersonal intelligence. And then springing from that work, emotional intelligence, or EQ or EI, was a concept that gained attention with the publication of Daniel Goleman's book of the same name in around 1995. And that sort of played on the widely recognized idea of IQ. Youth-focused approaches that combine emotional intelligence with other life skills have now come to be defined by the term social and emotional learning by educators in child development as well as psychology realms, and in certain business quarters that apply this similar learning to adults. So this might not necessarily be something new, but we have gotten better at defining and measuring it. So there is an extensive body of rigorous research, including randomized controlled trials, longitudinal follow-ups, and multiple replications that demonstrate promoting social and emotional skills gets results, and that social and emotional skills can be taught. So I'm going to talk a little bit about some of the aspects of that research. And so social and emotional competence has been shown to contribute to a range of positive youth outcomes. Interventions that include a social and emotional skills component have been found to have positive impacts on a student's sense of school community and commitment to school, violent behavior and school suspensions and school truancy and dropout, alcohol and drug use and conduct problems. In addition, social and emotional competence has been shown to contribute to academic outcomes. In 2011, the first large-scale meta-analysis of school-based programs to promote students' social and emotional development was conducted, analyzing 213 school-based, universal, so the entire student body, social and emotional learning programs involving over 270,000 kindergarten through high school students. So compared to controls, social and emotional development participants demonstrated significantly improved social and emotional skills, attitudes, behavior, and academic performance that reflected an 11 percentile point gain in achievement. In addition, compared to students who did not participate in social and emotional development programs, students participating in those programs showed improved classroom behavior, an increased ability to manage stress and depression, and better attitudes about themselves, about others, and about school. Social and emotional competence has been shown to contribute to many intermediate outcomes as well. In a 2017 follow-up to that 2011 meta-analysis, researchers evaluated results of nearly 97,000 students in 82 schools. Individuals were assessed 6 months to 18 years after the Universal Social and Emotional Development Program had ended. The study showed that 3.5 years after their last social and emotional development intervention, students fared markedly better academically than their peers in control groups by an average of 13 percentile points. Additionally, researchers saw that conduct problems, social distress, and drug use were much lower for students with social and emotional development exposure than those without. Up to 18 years later, students exposed to social and emotional development in school continued to do better than their peers on a number of indicators: positive social behavior and attitudes, skills such as empathy and teamwork and academics. And they have fewer conduct problems, less emotional distress, lower drug use, and many other benefits. The study also indicated that regardless of race, socioeconomic background, or school location, students showed significant positive benefits. This finding suggests that social and emotional development interventions can support the positive development of students from diverse family backgrounds or geographical contexts. Social and emotional competence has been shown to contribute to many long-term outcomes as well. So in a study released in July of 2015, nearly 20 years of data were examined. The development of social and emotional skills in kindergarten leads to youth that are 4 times more likely to obtain a college degree, more likely to have a full-time job at age 25, and lessens one's chance of substance abuse or getting into trouble with the law as an adult. The study concluded that early pro-social skills decreased the likelihood of living in or being on a waiting list for public housing, receiving public assistance, having an involvement with police before adulthood, and ever spending time in a detention facility. Adverse childhood experiences are the negative negative experiences and stressful events in childhood, including trauma, abuse, and neglect that a child may have witnessed or experienced directly. Negative health and social outcomes associated with adverse childhood experiences, or ACEs, have been well established. Developing the social and emotional skills of youth increases their positive childhood experiences and helps to reduce the negative impacts of adverse childhood experiences. So, experimentation of alcohol at an early age. Research has found that youth who have adverse experiences are at a greater risk of experimenting with alcohol at a younger age. When people experiment with alcohol at a younger age, this can increase their risk of developing alcohol-related problems later in life. Helping youth develop positive coping skills to deal with negative and traumatic events is a strategy to prevent those early onset of drinking. Promoting social and emotional development by strengthening the ability of youth to make constructive choices about their behavior, evaluate the consequences of their actions, and effectively manage stress, equips youth with skills that minimize risk for experimentation with alcohol. Research suggests that people who have experienced adverse childhood experiences are more likely to drink alcohol to deal with problems or negative feelings about themselves or their lives, rather than for pleasure or socially, as people who have not experienced such experiences might. Social and emotional skills such as managing stress and controlling emotions improve coping skills and reduce the negative impacts of adverse childhood experiences. Strong social and emotional skills can lessen the chance of using alcohol in ways that lead to substance use disorders. Research shows that children who have had adverse childhood experiences have a higher likelihood of problem drinking in adulthood. Social and emotional skills development protects children, helps them counter the negative impacts of adverse childhood experiences, and reduces their exposure to risky behaviors. These skills have been shown to significantly reduce substance misuse problems in adulthood. Whoops. So understanding risk and protective factors for substance misuse is key to preventing underage drinking. Ideally, protective factors should outweigh risk factors, and many prevention strategies to prevent substance misuse focus on strengthening protective factors to counteract the negative impact of risk factors. Social and emotional development can be a strategic approach to reduce risk factors and bolster protective factors associated with underage drinking. So I have 4 examples that show how social and emotional skills buffer risk factors for substance misuse and bolster protective factors. Negative peer influence is a risk factor for underage drinking. With peers, youth are more likely to take risks, make risky decisions, minimize how risky their decisions are than when alone. Negative peer influence is greater for adolescents than it is for adults. Social and emotional skills help youth cultivate positive social relationships with a variety of people. These specific skills include saying no to peer pressure and successfully negotiating conflict. These skills then buffer negative peer influence and reduce underage drinking. Youth develop beliefs about what is normal regarding drinking by watching their peers around them. These beliefs are called norms, and youth frequently have misperceptions of their social norms related to underage drinking. Young people tend to overestimate drinking by their peers. These misperceptions may increase the likelihood that youth make unhealthy choices and drink alcohol themselves. The ability to understand social and ethical norms for behavior is an important social and emotional skill. Understanding accurate social norms reduces underage drinking because when youth misperceive drinking behaviors of their peers, they're more likely to drink themselves. Difficulty in school and academic failure are risk factors for underage drinking. The development of social and emotional skills like self-discipline, self-motivation, goal setting, and organizational skills improve academic success. Furthermore, students who are successful academically are more likely to be connected to school, which is a protective factor against underage drinking. Depressive feelings increase the likelihood of youth who do not drink moving to a pattern of heavy drinking. Further, drinking to manage negative emotions is common among youth who drink by themselves. Strengthening the ability to manage emotions can serve to mitigate the effects of emotional distress and ultimately reduce underage drinking. So in a 9-country longitudinal analysis that found social and emotional skills mattered across countries. So the skills, social and emotional skills consistently affect outcomes like job completion, job attainment, health, and civic engagement across multiple different countries in this study. There's also data that demonstrates social and emotional skills can be taught to adults of any age. Workplace training and interventions have been evaluated and are shown to be effective in improving social and emotional competence and work performance. Given the many responsibilities in a day and the limited time frame for accomplishing them, we often find ourselves considering what tasks are most worth our time when prioritizing what to do. In other words, what's our return on investment? In a 2015 study conducted by Columbia University, it showed that for every dollar invested in a school-based social and emotional learning, there's a return of investment of $11, which is a return on investment most investors would envy. So the study analyzed the cost of social and emotional interventions and correlated it to what's spent every year in violence and crime. We know the majority of all crime is related in some way to substance abuse. So growing social and emotional skills improves health and safety. Over time, mastering social and emotional competencies result in a developmental progression that leads to a shift from being predominantly controlled by external factors to acting increasingly in accord with internalized beliefs and values, caring and concern for others, making good decisions, and taking responsibility for one's choices and behaviors. So to me, this is critically important because this is often the primary goal of the work that a lot of us are doing. So if we think about this in the lens of the social ecology, approaches to teaching and learning social and emotional skills has typically occurred within schools. We also know that efforts exist within workplaces. When we think about it, social and emotional skills can be seen as a common but thin thread in many components with the training and interventions we currently work on. For example, bullying prevention, drug prevention, violence prevention, mental health, and suicide prevention, just to name a few. So to me, this is super exciting. I have been looking at social and emotional skills and how it relates to many of the health and safety issues I've been researching for about 10 years now. So we know that social and emotional skills can be taught. We know the impact of teaching the skills can have long-term outcomes. And we can already find a thin thread of social and emotional skills in much of the work we do across the social ecology. I've often wondered, what if it weren't thin threads of social and emotional skills being developed across the social ecology? What if we could braid the thin threads together in our communities to create intentional efforts within our work, within our community, to promote and develop social and emotional skills across the social ecology, to create a thick, intentional, systemic rope? This would include a shared social and emotional vision with multiple stakeholders. So this is exciting for me. So in partnership with the Montana Department of Public Health and Human Services, I've recently had an opportunity to begin work on a project to engage Montana parents to reduce underage among Montana youth. So research has shown that parents and caregivers have a significant impact on whether a child chooses to drink or not. And we know that research has also shown that growing social and emotional skills of youth is protective against underage drinking, substance use, and other risky behaviors. So we began this project with a really small pilot test of Montana parents with a child in elementary, middle, or high school. And we asked, what are 3 skills a parent should have to help their child be successful? Parents identified 577 skills that parents should have to help their child be successful. Of those, 538 of them that they identified were social and emotional development skills, so around 93%. We also asked, what are 3 skills your child should have to be successful? They identified 572 skills they wanted their children to have to be successful, of which 520 of them were social and emotional development skills, so 90%. So parents, after we did this brief study, parents seemed to get it. So we developed a brief logic model or a theory of change for this project, and I'm just going to walk you through this. I know the writing is quite small, and there's a few abbreviations, and I apologize. We're going to look at the rightmost blue box there. So what we want, what we all want, I think, are parents engaged in best practices to reduce underage drinking, and there's a lot of tools out there to do that. So we began by looking at what are the best practices we wanted parents engaged in, and could we do that in a social and emotionally informed way? Let's take a look at the leftmost blue box. What we recognized was that underage drinking is one of the many conversations parents are having with their kids. We also have conversations about tasks like chores, homework, and conversations about friends. We realized that parents could apply a social and emotionally informed approach to many tasks or issues or concerns. What if parents could start having conversations that grew social and emotional skills at any age? If we could build social and emotional competencies of kids, that would transcend the issue of alcohol. So let's move to the rightmost green box. So in order for any person to engage in a more complex behavior, they need skills. And we wanted to recognize that we need to build a parent's skills. What if we could help parents have these underage drinking conversations with their kids in a way that grew a child's social and emotional skills? Let's look at the leftmost green box. We thought parents that had social and emotional skills themselves would be better at teaching their kids or doing a social and emotionally informed approach. This was our hypothesis. What if we could help parents have all conversations with their kids in a way that grew the parents' social and emotional skills? So this was the core backbone of our logic model. Looking at the orange boxes above, also, a parent's attitudes and beliefs about these behaviors matter. Just because you know how to do something does not mean you want to do it. So we also wanted to assess, if you're looking at the first orange box, we wanted to look at a parent's attitudes and behavior about underage drinking. And in the second orange box, we wanted to look at their attitudes and behavior about using a social and emotional informed approach. And in the third orange box, their attitudes and behaviors about social and emotional skills. And so we did a survey to assess the connections of this theory of change. So to begin this project in 2017, the center developed and conducted a survey of Montana parents about underage drinking to get a better understanding of the existing culture among Montana parents. We pilot tested several versions of the survey using an internet convenient sample before administering the final version using paper-mailed survey. We sent 4 mailings, including a pre-survey letter, a survey packet that had a cover letter, the survey, and a business reply envelope. We sent a reminder, thank you postcard, and then we followed up with a second survey packet to a random sample of 6,400 households across Montana. And here are some of the things that we learned. We learned that most parents in Montana are engaged in protective behaviors to reduce underage drinking. 82% of Montana parents are engaging in conversations with their kids about alcohol and its impact on health and safety. 66% of Montana parents have established a clear rule for their child about never drinking alcohol. 80% have established clear consequences with their child about what happens if these rules are violated. 90% of Montana parents recognize the need to model safe drinking behaviors, and 86% of Montana parents always monitor their children when they're out by having them do things like call or text. We also learned that Montana parents are following up with their children and holding high standards. 87% of Montana parents always uphold rules about not drinking alcohol. 89% of Montana parents consistently uphold rules about when their child should be home, like a curfew. 89% of Montana parents consistently uphold rules about having their child call or text when they're out. 85% consistently follow through on consequences when their child breaks a rule about drinking. And 94% of Montana parents regularly acknowledge their child when they have followed the rules and that they've established. So while most parents are engaged in these protective behaviors, there is room to grow. We know that currently about 1/3 of Montana high school students report drinking alcohol in the past 30 days. From our survey, we also learned that most parents in Montana have clear expectations about that drinking is not acceptable. 91% of Montana parents disapprove of underage drinking, and many believe that children should not drink until the age of 21 or older. 74% of Montana parents agree that parents should not allow high school-age children to drink in their home. 94% agree that parents should establish clear rules and consequences about not drinking. 93% agree that parents should discuss their children's future personal choices about alcohol to prepare their children for when they turn 21. Most parents have healthy beliefs about alcohol and underage drinking. 75% of the parents do not believe alcohol is necessary for celebrations and understand that underage drinking is harmful. 90% of Montana parents support enforcement of existing underage drinking laws, and 88% of Montana parents know that providing alcohol to a minor other than their own child is illegal. The survey also examined the social and emotional competencies of parents and how these related to their engagement in protective behaviors to reduce underage drinking, and a strong correlation was found. Parents with strong social and emotional competencies are over 6 times more likely to engage in protective behaviors than parents with low social and emotional competencies. So these results provided a better understanding of the existing positive culture when among Montana parents to reduce underage drinking. So while most parents have protective beliefs and are engaging in protective behaviors, there's still too many parents who are not. And this helped us understand that efforts with Montana parents should seek to grow their and their children's social and emotional skills, as well as protective beliefs and behaviors about underage drinking. So how are we going to do this? So launching in mid-January, parentingmontana.org will provide easy-to-use parenting tools that grow social and emotional skills in children, skills that lead to healthy and successful lives. The tools are appropriate for elementary, middle, and high school children. When we ask parents, these are their top concerns or issues that they ranked that they have when raising their kids. So on parentingmontana.org, parents will be able to search by age and by one of these issues for specific guidance on these topics using a developmental approach that focuses on building a child's social and emotional skills. For example, during the elementary school years, parents can begin to practice setting expectations and following up with consequences on behaviors like homework or contributing to family responsibilities, chores. Parents can use those same approaches with their children as they mature, establishing expectations and holding their children to healthy and safe standards about alcohol and other drug use. Engagement can continue even as the child leaves home for post-secondary education. The topics highlighted in blue show the tools that are developed that have a specific alcohol focus. So as the parents or those in a parenting role use these tools with their children, both the children and the parents develop their social and emotional skills, thus bolstering their parents' ability while strengthening protections for the child. Both parents and children learn to grow skills like self-awareness, self-management, responsible decision-making, relationship skills, and social awareness. By bolstering the social and emotional competence of parents as well as youth, parents become more effective and able to navigate parenting and underage drinking during the teenage years. The website will be supported with universal statewide media that will include a variety of video and radio suitable for TV or web or radio placement. There's going to be a variety of print pieces that includes rack cards, newspaper ads, billboards, posters, and social media. In addition, tools are being created for local prevention coordinators as well as stakeholders across the social environment, like teachers, healthcare providers, to bolster engagement by parents. So in Montana, the parentingmontana.org project, we now believe we have two threads. We know that many Montana kids are getting social and emotional skills taught in their schools. And by adding another thread, the parents, we have an opportunity to further strengthen the skills being taught together. We often are starting to look at, what else could we braid together? So I'll close today with just a few questions for you to reflect on. How are your current strategies addressing how are your current programs or strategies addressing social and emotional skills? And lastly, knowing that there's probably other programs in the communities that you serve that are addressing social and emotional development, how might you bolster the impact of your program or strategies by connecting to these other programs or strategies? I also wanted to make sure if you'd like to connect more with what the center is doing, we have a variety of trainings. We have a 2.5-day positive culture framework training that provides a foundation to improve health and safety efforts that address a wide variety of issues like substance abuse, traffic safety, and violence prevention. In addition, the center offers training in communication, social norms marketing, leadership, and integration skills. The center also offers a variety of services to assist communities and organizations to improve health and safety. Guide service, for example, communities and organizations often find that ongoing guidance and support from the center contributes to their success. So we offer a trained guide as a personal consultant who's available by phone and email to support efforts to improve health and safety. The guide is available to provide feedback and guidance on leadership development, implementing communication efforts, managing prevention strategies, among others. We also develop assessments or surveys and evaluation services to better understand cultural factors, facilitate ongoing effectiveness, and prioritize potential strategies and inform future needs. We also have a variety of webinars that are located on our website. All of our webinars are recorded for viewing or sharing later. Here's just a few of those topics. So please contact us if you want to discuss opportunities to collaborate. And I thank everyone for joining today. Again, the webinar will be available online. It won't take very long, probably within the next day or so, as well as the handout. And then you can always get a hold of us at our website below as well if there are any questions to follow up with. Thank you.